Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then in the proptosis can also be measured by a exophthalmometer which is called as Hertel's exophthalmometer. So this is the picture of Hertel's exophthalmometer. So this Hertel's exophthalmometer will measure the distance between the apex of the cornea and the lateral orbital margin, and if this distance between the apex of the cornea and orbital margin is more, then we can label the patient as proptosis. Then we also have other exophthalmometer which is called as Lued's exophthalmometer. This Lued's exophthalmometer is actually useful in children. Similarly, we also have topometer. This topometer is mainly useful for non-axial proptosis. Okay, so
thank you and thank you for watching.